see, with this one like this, can we not raise it so that this one will not show? No way. Okay. 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 It's 7:30. There's this live that I watch that the people are playing music. The music is not, it's from the. This was the way we playing bang 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 bang, but I don't think it's rhymes with what we're doing. Okay. I can't hear you. Hello. Hello, hello, hello. And I welcome you. Hello, hello, hello. I welcome you to the Ask Dr. Rita show this evening. I thank you so much for joining. We're live on Instagram. Trying to set up my Instagram um, to show very well. Yes. Live on Instagram. Thank you for logging in. Please let me know where you are joining me from so that I can know how to reach you. Okay, today we are talking about the impact or the effect of. Thank you so much for joining. I truly appreciate. You can drop your comments. Today I'm talking about the effect or the impact of uncontrolled diabetes on the liver. So, because this is Christmas time and a lot of people are wondering how are they going to, what can they do? Can they just ignore and just be doing as they like, you know? So I thank you for logging in. I'd like to know where you are watching from, on YouTube, on Facebook, on Instagram. Talking to you today on the impact of diabetes on the liver. Impact of diabetes on the liver. All right, so let's delve in. As you can know, or in case you do not know, diabetes is a condition in which the body is unable to regulate its sugar level. That's usually what diabetes is. And at this time, when someone is diabetic, they are already aware, or sometimes some people are not even know, they don't even know that they are diabetic until it's quite late. You know, that's why some people get to the time of complication before they get to know that, oh, they are diabetic. Diabetic itself is a metabolic disorder. And like I said, it's a condition in which either the body is not producing insulin, which can be categorized as type 1, or the body is not utilizing the insulin that the body produces, which is categorized as adult or type 2 diabetes. Now, one comes from the one that the person's body is not producing, that's usually from childhood, while later on, the body is producing, but for some reason, it's not able to utilize it because of dysfunction in the system. Now, one thing that you need to understand, the liver is a very important organ, and it is the chief metabolic organ of the body. That means that everything that has to do with absorption, digestion, use of anything, breakdown of anything that you consume, that is one of the key functions of the liver. And because of this, when the levels of the sugar in the blood begins to spike to and fro, up and down, what happens is that the person may the part of the receptors in the blood that are responsible for identifying when the sugar levels are abnormal, and then signaling for either a production or a mop up of the sugar in the blood. When these spikes continue over a period of time, they affect the functioning, the overall functioning of the liver. And that's why it's not okay for you to just say, oh, you don't want to take you are diabetic, you just want to leave it. There are ways that you can maintain your sugar level, but one key way that you must use to maintain your sugar level is to, one of the key ways to maintain your sugar level, the first thing that is required really is actually checking your sugar reading. Because these uncontrolled high levels, they become a problem because you are not even aware. The person is not even aware, So that's one thing that the person needs to know. Now, we're going on. So, in the case where there's sugar in the blood, when the levels of sugar in the blood becomes much more, one of the ways that the body, preservation mechanism of the body is to mop up the excess glucose in the blood and take them to the liver and store them as glucagon. And also, when there is a period of maybe you are fasting or you are not able to eat, or even in the night when the cells of the body are requiring glucose, the signal goes to the liver will convert the glucagon back to the glucose for the body to utilize. So you see, the storage of the excess of sugar in the blood is actually done by the liver. Now, what happens is that when the levels of high sugar becomes prolonged after a period of time, what the body does is that this excess glucose are also stored as fat. They are now stored as fat. Now, when they are converted to fat, they now become stored. Sometimes they first of all become stored in the liver. And when they become stored in the liver and the quantity of the fat becomes more than 5% of the liver fat, of the normal liver and the organ, and then like more than 5%. So what happens is that the body, the excess fat results, the excess fat stored in the liver results in a condition known as non-alcoholic fatty liver disease. You see, the person does not smoke, the person does not drink, but he has this non-alcoholic fatty liver disease. It is because of the excess of fat. So you see, it starts with high sugar, for a period of time. The excess sugar becomes stored as fat. The excess fat is stored in the liver. Over a period of time, it becomes, causes, they spread across the liver cells up to 5%. This is a condition known as fatty liver disease, or non-alcoholic fatty liver disease, or metabolic liver disease. This is the first stage. Now, from there, it progresses from it being non-alcoholic fatty liver disease, it progresses to non-alcoholic steatohepatitis. This is this progression that causes inflammation in the liver cells. So the person is first of all has uncontrolled sugar levels. Today the sugar level goes up, tomorrow it comes down, goes up, come down, goes up, come down. It becomes excess of the body stores those excess glucose as fat. This fat that is converted, the body converts the excess glucose to fat. Now this fat is now stored in the liver. The storage of the fat in the liver causes the condition known as non-alcoholic fatty liver disease, or fatty liver disease. So you find, I've had a lot of people in this month of November, December, even in this month of December, from November, I spend a lot of time talking about the liver, and even in this month of December, I'm talking about the liver and the kidney. And then people just randomly go to the hospital and they find out that they have fatty liver disease, either grade 1, grade 2. Some of them have fatty liver disease with enlarged liver. Now, when the condition starts, it starts as fatty liver disease. When it stays longer, it becomes fatty liver disease, and it also leads to inflammation of the liver cells. Now, inflammation of the liver cells could progress and begin to form necrosis. From the necrosis, it becomes fibrosis. Fibrosis meaning that as the course of the body is trying to repair the liver cells, what is happening is forming scar, the way you have scar on your body. Now, one thing you need to know about the liver is that the liver itself has the ability to regenerate itself. It has the ability, it's like pocket of, like the way your sponge is. That's how the liver is. It has the ability to regrow, to regenerate itself. Now, when there is this fatty liver disease or this inflammation, what happens is that they begin to cause inflammation, that causes scars. Now those scars now begin to block the areas of those areas of the liver. They cannot now regenerate. That's now the issue. The issue is that the scar formed from the inflammation now causes the liver, that portion, not to be able to grow. Once it's not able to grow, what happens? It lacks oxygen, it begins to die. At this point, when it becomes liver cirrhosis, please, we are looking at ensuring that your glucose levels are maintained. When your glucose levels are maintained steadily, 24 hours, clearing steadily, you will not have converting glucose to fat. And this also goes for people who are going, who do a lot of long-term fasting. As have your heavy meal in the afternoon, have your vegetables in the evening, have your fruits or your semi-solid in the morning. Now, where does frizzy drinks or juices come into play? So, because when we are looking at what people are eating, what people are consuming, the tendency to want to just assume that, oh, they are drinking unhealthy things, they are drinking frizzy drinks, they are taking alcohol. You may even be eating the right thing, and that right thing can also lead you to have uncontrolled sugar levels. So, in the mornings, a lot of times people want to go on juices. Now, juices in themselves are not bad. The only challenge is that juices tend to cause your sugar levels to spike. And it is this If this consistent spike and drop and spike and drop and spike and drop that affects the regulation, the ability of the body to regulate your sugar levels in the first place. So this festivity is better you eat your fruits in their whole form. It is also much better that you take, if you have to now break them down, don't break them down into juices, break them into smoothies. Smoothies with the fiber. So, for instance, you want to have what now? Maybe apple and watermelon. What you should do is not juice the apple. What you should do is cut the apple, remove the seeds, and then blend it. But in blending it, don't blend it to be fine, smooth. Blend it to be coarse, blend it to be coarse so that when you are taking it, you are not drinking it. It can become like a semi-solid, that's a safe way to take vegetable without causing it to cause your sugar levels to spike up, to jump up and jump down. If you get what I mean. If you are watching, I'd like to know where you're watching from. Okay, no audio. Okay, can you hear me now? Please let me know if you can hear me. Can you hear me? Can you let me know if you can hear me, please? On YouTube, please, can you let me know if you can hear me? Okay, thank you very much. All right. So, okay. So, as I was saying, I was talking to you about the impact of juicing or juices. Fruits are good. They contain simple fructose. Simple. Simple meaning that they do not need too much effort for the body to break it down. But then you need to also understand that because they are simple, they are faster absorbed, they are easily absorbed. Now, when you make them into juices, they are, oh, okay, thank you. Although the audio went off, but back. Okay, thank you so much. Thank you for your feedback. Thank you so much. Thank you so much. That's from Instagram. Just checking with them on YouTube to be sure that they can hear me. All right, thank you so much. You can hear me now. Thank you so much. All right. So I was saying to you that the best way for you to have your fruits this festive period in making it, ensuring that you don't want after Christmas. Oftentimes in January, what are the cases that come to me the most? Cases of very high levels of cholesterol, abnormal triglyceride, fatty liver, and that's why from November and up till now, I've been singing, I've been shouting, I've been educating on the ways to protect your liver. Your liver is a very important organ. You need your liver to do every other functions of your body. Your liver is what compensates. If your kidney is failing, your liver can step up to compensate. When your heart is failing, your liver can help. Your liver is a very important organ, and the liver cannot afford to shut down. And everybody has just one liver. We don't have another spare of liver. Someone asked me a question: can liver be donated? Yes, someone can donate their liver, but that donation is at the point of death. You cannot donate your liver. So you people sign up for organ donor. Their organs can be transplanted into someone else. Yes, liver transplant is possible. Usually, when someone has liver cirrhosis, depending on the stage of the liver cirrhosis, because at the time when the person's liver is becoming cirrhotic, it means that the damages are becoming more permanent. The damages are becoming more permanent and more irreversible. So, as simple as uncontrolled sugar. Okay, I'll answer your question, Maribola. Thank you for that question. As simple as uncontrolled sugar is, uncontrolled sugar from your fruits, from your food, and I must say to you, everything that you eat, for the body to utilize it, it has to be converted to glucose. So if you are on a particular diet and you say in that diet, we don't eat carbohydrates, we are only eating fruits, we are using lettuce to become swallows, or we are using only protein,
Your body can only use glucose. So if you like eating only fats, the only thing with all those other means of that people do is that you increase free radicals in your blood, because when you start using fats to do the work of the simple carbohydrates, the body will go through the process of breaking it from fat, break, and converting it to glucose. Yes. So it causes there's a long method process of digestion, but for your body to get energy, it has to change to glucose. So everything you eat, your body changes it to glucose. You needed to settle that. Now, when the levels of glucose in the body becomes, today is high, tomorrow is low, tomorrow is high, tomorrow is low, those unnecessary spikes causes the body to lose its sensitivity. Now that results in uncontrolled sugar levels in the blood, uncontrolled glucose in the blood. When the body is receiving sensation that, oh, there's glucose is more, what happens? It begins to store those glucose as fat. When these things are converted as fat, what happens? The body is looking for where is it going to put it now? Where is it going to put it now? Go and store it in the liver first, because the liver is the only organ. So it will absorb it first. It's okay, let it hold. The issue is that when this fat is stored in the liver, it makes the liver to become fatty, because the constitution of fat in the liver becomes more than normal. From there, it progresses through the stages that I've mentioned to you. So let me answer your question. You said, is there fruit with high sugar content to avoid, or what are the dangers of concentration of over concentration of consuming such foods? Now, the truth is this: the foods and fruits have different glycemic index. That means the time it takes for a food to cause your sugar level to spike. Some have low levels, others have higher. Generally, vegetables have lower sugar index because they have more fiber than some of the fruits. But whether you're taking fruits or you're taking vegetables, when you take them in their whole form with the fiber, you are less likely to have a spike than when you take them in juice or in concentrated forms. That's one thing you need to understand. Then also, when we're talking about fruit concentrates or concentrate danger of over concentration of such fruit, we're taking concentrates. Concentrates are actually loaded with sugar, or the sugar from the fruits have been extracted and been made. That's why it's a concentrate. You see, so those things tend to cause your sugar levels to spike. The best way to have any fruits really is to have them in themselves. You chop them in small quantities. When you chop them into small cubes, then you can have them. I generally used to say that fruits, that best way to eat fruits is to have fruits that are together, that taste very sweet. Have them with fruits that are not very sweet. Do you understand? There are some fruits that are very sweet. There are some that are not very sweet. For instance, let me just think of something now. We can talk about, let's say, pears. Pears, English pears. English pear and pineapple. Pineapples are sweeter. Pineapple, I think, has a glycemic index of maybe 79 or 81. I'm not very sure now. I need to check that. 17, 79, 81. Whereas apple has maybe like 54, 45, or 51 or something like that. But pecan pear has like 48. See, these things you can easily check them online to find them. But you see, when the fruit tastes very sweet, have it with the one that doesn't taste very sweet. And that's why the best time to have your fruits really is in the mornings. When I give my food plan, or when I give people health advice, I tell them have your fruits in the morning, so that by the time you're having it in the morning, by the time your body is breaking it down, your brain receives the one that it needs to have. And then as you walk your way through, by lunch, it should have been far gone. And then have your heavy meal with your fibers in the afternoon, and then have your vegetables in the evening. When you have your vegetables in the evening, what happens is this: digestive pressure is reduced, and then it gives the body more ability to mop up, because when you go to do your FBS, what are you checking? You are checking how much the body was able to clear in the last 24 hours, all of the glucose that was available in the bloodstream. So in the morning when you wake up, when you're checking your fasting blood sugar, you are checking to find out that in the last 24 hours, your sugar, based on all you ate, ones that spiked, the ones that were normal, your body was able to clear everything from the bloodstream. You see, now when you eat late into the night, the time it takes for the body to clear is not enough. Usually, between your night and your morning, if you eat early into the evening, what will happen is that between the hours of 12 and 1, the cells, your repairs of your body takes place when you're sleeping. The cells, in the course of their doing a work of maintenance and repairs, they will demand for glucose. When they demand for glucose, the signal, the sensors in the blood will note that, oh, the glucose levels are dropped. And so what happened? They immediately send a signal to the liver. The excess glucose that has been converted to glucagon will be reconverted back to glucose. And then you see, so this process is one of the ways, one of the defense mechanisms that the body sets up to be able to protect you. So in this festive period, you're going to visit families. Families are going to visit you. You have a lot of temptation. Don't forget, whether you are up late into the night and you have to eat something, it's better you eat vegetables. Have your vegetables, you can have your salads, have a lot of salads, have them with some protein. You know, when you match them like that, it's easier on the body. You see, it's easier on the body. So, um, I hope I've been able to answer your question. And if there are any more questions, I'm going to be taking that because we're supposed to be finishing this live 8 o'clock. Today, I spent a lot of time talking to you about the effect of uncontrolled sugar levels on your liver and how uncontrolled liver levels, uncontrolled sugar levels can cause your liver to have problems. I said that when the liver, when the sugar level, when the things you're eating or your sugar levels are high for a long period of time, it can cause the body to store those excess glucose as fat. Those fats become stored in the liver. The liver now becomes fatty. The fatty liver changes, you see, and then from there begins to go through the different stages. Now, I told you, I said, one thing, one test I need you to do this festive period, I need you to do your HbA1c. That is a test that checks how much of glucose is blind, how much of glucose or sugar is binded to each individual red blood cell. This helps you to make better health decisions. Now, if you are diabetic and you're looking, yes, one should try to eat more vegetables, and your vegetables should be more in the evenings. Vegetable is not that one that I'm not talking about that one that you now go and cook your vegetable and say, no, no, no. The vegetables I'm talking vegetable salad in their raw state, like your lettuce, your cucumbers, your carrots, your purple cabbages, that sort of, tomatoes, that sort of vegetable. You have them in the evening, you can have a little protein, small protein to it, and then you're good to go. So yes, that's what I'm saying. And then I'm also in closing saying to you that if you are diabetic and you want to stay off drugs, you must be ready to check your sugar levels every day. You cannot control what you are not monitoring. I've treated people who, thank God, by the grace of God, have been off drugs for diabetes. In the course of that treatment, some of them were in the therapy for 1 year. In that 1 year, they were sending their blood sugar reading every day. And every month we're monitoring their HbA1c up until it became normal, it became dropped. That's what helps you, because the amount of glucose that binds to your red blood cell is what tells us what is the rate of sensitivity of the receptors in the blood. So natural remedy can help you, yes, but it requires a lot of commitment, it requires checking. So it's not like you just say, oh, you are drinking one thing and then you're not checking your sugar reading. I mean, people come to me and I'm like, when last you check your sugar reading? And they're like 1 year ago. I'm like, you cannot check your sugar reading 1 year ago and expect it and think that the lifestyle or whatever you're doing is going to control it. You are joking with the complications of uncontrolled sugar. I'm not saying this to scare you, but I've said quite a lot. If you didn't start this live from the beginning, I'm going to drop the video. It's going to be on Instagram. It's also going to be on YouTube and on Facebook. You can watch it and watch from the beginning. It's a 30 minutes video that talks to you about the effect of uncontrolled sugar on your liver. Now, this month of December, I have a health combo available for you for just 85,000 for Christmas. We are giving it. The combo has been year round. For this December, just for the sake of Christmas, we're giving 85,000 more. And what does that mean? That means that you get 30 minutes consultation for us to be able to take a history of your health and your body to know how your problem started and what you did to cause the problem and how we can help you. And then you have a 6 weeks therapy, and then you have the food guide. I talked a lot about the food guide and how to balance your diet. When you get that health combo, you actually are going to get your food guide. The food guide gives you suggestions of what your breakfast should be, suggestions of what your lunch should be, suggestions of what your dinner should be. Let me tell you, one of the key ways to reverse diabetes really is to make sure that your liver function is at the top notch. If your liver can support your pancreas, your chances of reversing your diabetes is much higher, especially type 2 diabetes I'm referring to. So I want to say to you this evening that as we go about preparing for Christmas, having a nice time, remember to eat healthy, to take plenty of fluid, and to reduce alcoholic consumption. Yes, somebody can have a non-alcoholic fatty liver disease because while the person is not smoking and the person is not taking um, alcohol. Someone can have fatty liver disease. Someone can have inflammation of the liver from excess of fat, even though the person is not taking alcohol. The person is eating plenty of carbohydrate. The person is eating plenty of fatty food. The person may not even be eating plenty of fatty food. The person's sugar levels may just be uncontrolled. And those uncontrolled sugar would now in turn be stored as fat that becomes stored in the fat and makes the liver to become fatty. So I hope that you have had a wonderful time this evening. I'll see you next week. Next week, we're going to be talking about something else as we look at both the kidneys and the liver and the things that you can eat to help yourself. I hope you have had a wonderful time this evening. Thank you. Yes, this is every Tuesday. We have this every Tuesday, 7:30 to 8 o'clock by the grace of God. And by the grace of God, next week you're going to find me here again, and I'm going to talk to you more. Next week, I'm going to be talking to you about the impact of uncontrolled blood pressure, uncontrolled sugar on your kidneys, and the things that you need to do to keep your kidneys safe. You don't want to miss it. You have to prevent kidney problem. If you think you have problem, please don't add kidney problem to it. If you think you have problem, please don't add liver problem to it. Because if you think you have a challenge, if you go and have a liver problem, imagine the challenge you have now, multiplied by 1,000,000%. Is not even up to the pain and the discomfort associated with both kidney and liver problem. That's why I'm ministering to you. I'm ministering healing. I'm ministering health knowledge to you for you to make good decisions and wise decisions. I'll see you next week, Tuesday. Have a good evening. God bless you. Bye. Bye bye. So, what did you learn, Damilola? Have you did not learn? Yeah, I'm not good to have You say wetin? Why class I learned that it's not good to have And this one don't obsist now. This one go. I know what the start and let's see. But why we no come charge am? What did you learn? Because you can't sit here, Damilola, right? And be in this place and suffer like somebody who did not know. What did you learn?